Welcome to the Reinventing the White Coat podcast, where we delve into conversations aimed at helping you foster a healthy relationship with your career and yourself. If you're a physician feeling unfulfilled or burned out, or want to prevent yourself from going down that path, then this podcast is for you. I'm your host, Jennifer Shaer, pediatrician, chief wellness officer, and executive and life coach. Sit back and relax as we explore ways to live your best life and have a career in medicine. Today, I welcome Dr. Todd Otten. Todd is a family physician who is on a mission essentially to improve healthcare. He calls himself a fierce advocate for healthcare workers and patients, which I kind of love that combo. So, Todd, welcome, and thank you so much for joining me today.
Oh, it's truly my pleasure. I'm excited to be here. Thank you for having me.
All right, so why don't we start, if you don't mind, telling me a bit about your story, how you got into medicine, family practice, give me your background.
Sure. So I guess I got into medicine. I was interested at a pretty young age, I would say, probably in high school. I enjoyed science, and I worked as a Parks and Rec supervisor, and the interaction with the children and the leadership. And so my mind kind of gravitated towards maybe being a physician. Then I sort of got locked in on that straight through college into medical school, and the story gets probably interesting after medical school, I suppose, from the perspective as to what I'm doing now. I graduated 2002, did a year of general surgery actually first, because in the Navy you don't go right into residency a lot of the time. And so I loved operating, but the culture of the training just it wasn't for me. And so I had a crossroads there. Fortunately, I then trained as a flight surgeon, which is a misnomer. It's more primary care for the squadron.
How'd you
Um,
decide to go into the Navy?
oh wow, a random phone call.
You're
Literally,
kidding.
I kid you not. I finished college a little bit early, and so then I was working at a quality assurance lab, and I think I was covering the midnight shift for the QA lab, and literally got a random phone call from a recruiter. Is how that journey began. And so then, fast
Yeah.
forward to the
Was
time.
it for I know it's the people who I know primarily who have gone that way have done it because of the financial, um, if you give us X number of years, we'll pay for.
Yeah. That was a big driver. And my wife's family had a fair number of individuals in the military. And so I talked to them. I talked about the pros and cons. The finances of it were definitely a driver at the beginning. But, in the end, it was a blessing because I initially, when I came out of medical school, I thought I wanted to be a trauma surgeon.
Hmm.
And ultimately, I really found my true calling as a family physician. Um, and had that phone call not happened, who knows if we'd be even talking right now. And
Right.
so yeah, it's just interesting how you think back on all these things and how they lined up and got us to this point.
Yeah.
And so yeah, so I guess back to the story. I did about 3+ years as a flight surgeon, which was fantastic. I often joke that it was kind of like being a doctor in a fraternity, um, because you have all
You
these.
are. You're not a surgeon. It's so funny. I remember the first time I learned that a flight surgeon was not actually a surgeon in flight.
Oh no, not at all. No, I have never operated on anyone in an aircraft. So yeah, so then I came back to Michigan. I finished my residency in family medicine. And then I started my job search very early because I was off cycle, it's non-traditional, I had a lot of experience. And so I realized, there's nothing wrong with looking early. And frankly, that's really, I would make the case that every resident should start looking early because there's jobs all over the place, right? So I got a wonderful
Yeah,
job
but
at a
who has time when they're a resident to start looking?
all
You
right, fair.
barely have time to go to the bathroom.
Yeah, I suppose that's true. But so anyways, yeah, I was at a critical access rural hospital for 13 years, and most of it was amazing. But in
Tell me about
2019,
that. What was amazing?
oh well, okay, yeah, sure. Um, Well, I love seeing patients, Jen. I have a passion for caring for people. I really do. And most of the days would fly by. Um, I got the leadership positions that I wanted to have when I was there, including one that was unexpected, being an ACO medical director for 6 years, and that was fantastic. I learned a ton, and that's where I was introduced to the triple aim and then the quadruple aim, and really
So
gravitated towards that.
what are those, if you don't mind just sharing
Uh,
for the,
sure,
yeah.
sure, of course. So the triple aim came out in 2006 from the Institute for Healthcare Improvement, um, and it revolved around population health, really managing it, that cohort of patients. And the three tenets were really patient experience, quality care, and then lower cost per capita. All wonderful things for sure. Um, Unfortunately, it really didn't address the wellness component, which is so important, especially in today's landscape. And so in 2014, Dr. Sinsky and Dr. Bodenheimer in the Annals of Family Medicine suggested a fourth component being clinician wellness. And I was like, a fly to the fly trap or whatever description you want. I was like,
Mm.
oh yes, we have to do this. And so I wouldn't shut up about it.
Yeah.
I
But
talked about,
why
well,
though? I mean, why do you think that that became necessary? Like, what was wrong with the trip? Because really the outcomes that you describe in the triple aim are really what healthcare is looking for.
for sure, I think, but I think when those are all that you focus on and you don't account for that wellness component, it creates layers of additional clerical burdens, box clicking, time constraints, prior auths, what have you. And all the studies show that when you don't pay attention to wellness, the other three components of the quadruple aim are adversely affected.
Yeah.
Um, and we all know that, right? Like when we're not at our best, we are not giving our patients our best for sure.
Hmm.
When we're not practicing self-care, how can we truly give our best to others? So I think it's critical. And like I said, I was nonstop about wellness this and wellness that. And it was interesting though, because for about 6 months, it was, everyone's like, okay, Todd, he's on this wellness kick. But then eventually everybody started to kind of latch onto that. And all of a sudden
At your
immediate
at the where you were working? Where were you? What
yeah,
was it, a private practice, a large, like what kind of a place was it?
for sure. So at the time I was chief of staff at the critical access rural hospital. And so I would lead medical executive meetings, and I was at the board meetings for the hospital.
Hmm.
And I would bring it up I would bring it up anywhere to anybody that wanted to listen, frankly.
And you were
Um,
seeing patients a couple days a week? How often were you seeing patients?
oh, I was seeing about, at my peak, about 6,000 visits a year at that time as well. It was obviously leading into the burnout that would come in
Right. But what did that
2019.
look like for you on a week to week basis? How,
So probably you could say 4.5 days a week
uh-huh.
of seeing patients, and
And
then
all that leadership stuff.
trying to jam everything else into every nook and cranny of my
Yeah.
day. Every lunchtime was a meeting,
Yeah.
meetings driving to work, meetings at night. It was,
Yeah.
in retrospect, it was too much.
It's funny because I know that for me, when I do, I do a little bit of both administrative and patient care. And my whenever I say that I'm working, I'm only talking about the patients, right? Like if I have a
Yeah.
meeting, I don't say like, oh, I can't that I'm working today. But so it's like we try to fit that administrative stuff into the personal part of our lives and not into the,
Totally. I was probably, just the patient volume was just incredible. I think at my peak, the average family physician's about, I don't know, 5,000 RVUs, give or take, in a year. And at my peak, while I was doing all these other things, I was at about 7,500. And then you throw all this other stuff in there. It's like, how many FTEs was I really, doing at that time? I
yeah,
don't know. I hadn't really calculated it, but it was just, and we all do that, right? I mean, to one degree or another, we all just, that's how we were trained. We'll just do
right,
more. Just
right,
yes, 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 yes. And then the answer
right.
should be let me think about that, and maybe no at times, right?
Right.
So
Right.
anyways.
So Todd, you were about to tell me that you weren't practicing what you preach a little bit. That tell me what that looked like.
Yeah, as all this evolved, as I said, many of the years are really good, and I really enjoyed the leadership roles. But thinking back on it, like every med exec meeting, I would get a tension headache, every single one. And not that the meeting was bad or there was a lot of drama. It's just, that extra pressure, right? And it's easy to realize that in retrospect. But yeah, in 2019, it just all came to a head, if you will, and kind of the tipping point occurred when I got some pay withheld because I had literally two open charts. Um, and I couldn't close them, and MA had to check a couple boxes. I think it literally took like 60 seconds, and that's when the wheels came off the bus, if you will. And there were warning signs leading up to this, but
Wait,
unfortunately, I
time out for a second. Did you
sorry,
get
sorry,
any? I
I
mean, that just horrifies me because we're in the middle of actually doing it in EHR. We just finished about a month ago an EHR upgrade, and a lot of our doctors are having trouble finishing the charts. And yes, there are can be consequences, but there's a lot of training and touching base with them and seeing, what's going on. What do you need? Do you need retraining? Do you need, did that just come out of nowhere? Or was there any support for you? Any communication with you?
around
The charts, I mean, two charts aren't closed and suddenly you're docked pay.
it was uh the intent of that citizenship component was really to address habitual offenders of
Uh-huh.
not completing charts. But the way it was set up, it literally was twice a year they would do a chart reconciliation, and I guess the rule is interpreted as black and white.
Mm, yep.
um you know, and I appealed it. I'm like, look, this is not what this rule is for. And I was actually involved in the creation of the contracts and writing some of this language. And I'm like, this is not what we're trying to accomplish.
Yeah.
And they stuck to their guns, and phew, I lost it. I
Yeah.
resigned this and I resigned that. And I'm like, you
Oh,
know what?
wow.
If you know what, you don't like the way I'm doing all this, do it yourself. And so
God,
that
how
led to
often our like rules, our intentions, get completely messed up in the implementation of our policies. I mean, they lost a major leader and a great doc over this, huh?
well, yeah, and it just, Jen, I think back to that time, and the embers of burnout were there, and they were smoldering. And this was like somebody just dumped gasoline on it or threw a
Mm,
bomb on it, and it just exploded. I mentioned on another podcast, I remember sitting in my backyard vividly when this happened, just crying.
oh,
I hated my job, the job that I loved, and it I was broken, and it probably really took 2 years after that for me to really get some semblance of the leader and the clinician I once was. But yeah, for quite some time, it was painful, very painful.
yeah. So you quit that job completely, like came
Not
in like
no
a wrecking ball? Like what happened? Is that the end of your career? What?
no, I was close. I was literally close to just walking away with like no plan. And financially we were okay, so we could have gotten through that period just fine. But I had a really good CEO who had very wonderful vision. He was a good leader. He wasn't perfect, but just a lot of great traits. And he came over that day when it was kind of all imploding, and all of a sudden my schedule started melting away in the afternoon. Like all of a sudden there was no more patience, and he came over at lunch, and he basically told me, just be quiet and listen. Because he didn't want me to leave, and he
Hmm.
knew I was like ready to walk out the door. So they gave me a 3 month sabbatical, if you will. I
Uh-huh.
did some counseling, which was, I was trepidatious at the beginning, but in the end it was just wonderful, and I still see that counselor to this day. Um,
Amazing. No shame.
no, and yeah, and I accepted where I was at and learned from it, and I came back and I was better, but I was not the same, not even close. It took a while. It really did.
So did you spend time, even though that was the trigger, right? Re re-examining your priorities and what you wanted to do? Like what was your next? You took the sabbatical, then what?
Yeah, wow. So first and foremost, I vowed that I would never get burned out again.
Hmm.
And there was gonna be decisions that would have to be made, and I write about that in the book. But
Yes, time out for the book. I have to
sorry,
just
I always
say,
do that. I'm
I'm
so
gonna
bad
give
about that.
give you a shout out of the book at the end, but I'm gonna just say right now it's called Ripple of Change, and I haven't gotten through it completely, but the whole concept of ripples of change is I just love the metaphor.
Well,
We could
thank you.
talk more
I
about that.
and I
Um,
owe a debt of gratitude to my co-author for that one for sure.
yeah, but go back, go on.
Oh yeah, sure, for sure. So I think one of the probably the biggest lessons in that time, Jen, was I learned the power of no, and I realized like I want to focus on seeing patients, and when things come up, maybe I'll consider them, but I had the capacity at that point to really say, you know what, I need to focus on myself. I need to focus on my family. And I
Mhm.
need to focus on seeing patients. And things would come up. Like I got offered multiple other leadership positions, and I'm like, no, not right now.
Mhm.
So that was the biggest thing that came out of that.
Yeah. Why do you think so many of us have trouble saying no?
Well, at least for me, and I would imagine for you too. I think in our training, we're just taught to do more.
Hmm.
Patient comes first, at the expense of potentially other components, including self-care,
Yeah.
which I think is rearing its ugly head in massive ways currently when you look at mental health and burnout and moral injury, and least of which is the suicide rate in physicians.
Hmm.
It's egregious,
Yeah.
that this is happening. um, so I think that's a big part of it. The compartmentalization is all well and good until it's not.
Yeah.
And then when it's not, it's like, oh boy, the negative ripples are just unbelievable.
Yeah.
So
I had this like aha moment this morning of a metaphor. I feel like our life is literally like an all you can eat buffet. Okay. And the food will never end. The patients will never end. The work will never end. The emails will never end, right? And so if you don't learn how to intentionally go into that meal, deciding how much you're going to eat in advance, right? I mean,
yeah.
saying no to someone else or to an opportunity or something is really saying yes to what your intention is, and we don't learn how to do that, and we are all suffering as a result.
Yeah, I that's one of the things that I think needs to, and I think in some instances it has. I'm not too deep in that world of medical education at this point, but I have heard some very positive things at some different institutions, and I couldn't name names right now,
Hmm.
of thinking about it differently, how they train and how they're learning is very different than when you and I went through the process.
Right.
And I think that's a good thing. I think if we keep going on this, or had we keep continued on the path that you and I were on, I don't know that it would improve. So I'm glad to hear that
Yeah.
changes are.
Now,
But
there are a lot of people who are in this space of trying to transform healthcare for the better for the people who are in the system, heal the healers, so to speak, and heal the system so that we can all benefit. But you have a really interesting perspective, different from most people, which is you took the doctor patient together. Tell me how that came about and what you do with that.
oh, for sure. I think, when I think back on my career, and certainly there was some negative interactions, but the vast majority of my patient interactions were very positive. And as a family physician, I would imagine similar to a pediatrician, you get to know your patients very well.
Yes.
And that fills your cup up when you see those wins and you get the
Hmm.
gratitude and what have you. And I think the best clinicians that learn to embrace that can really use that as a motivating factor, or that positivity to not only help the patients but their staff and what have you. And I guess I'm mumbling and digressing a little bit. um but the reality is, oh, I lost my train of thought, Jen. I got so excited.
No
I,
pressure.
no, and I've done a ton of these. So with Joshua, he was struggling.
So Joshua
um
was your patient.
Yeah, Joshua
Okay.
Judy's was my patient for 13 years, and the co-author of the book. Um, and interestingly enough, the medicine that I had written for him was duloxetine. And for many clinicians, we use duloxetine for neuropathic pain, and that's why I used it for Joshua. He had cervical radiculopathy. We had done traction, physical therapy. He had gone to see, he had injections and seen a neurosurgeon, and we weren't really getting anywhere with
Hmm.
his pain control, analgesics, what have you. And so I offered him duloxetine. Unfortunately, he had not only devastating side effects when he took it, but when he tried to come off of it, it essentially shut down his hypothalamic pituitary axis to
Oh,
where he's now on testosterone and thyroid as a result of this. I mean, you talk about this crazy Swiss cheese model lining up for him in a negative way.
yeah.
And so he's going through all this, and he's getting to a deep, dark place as a result of this.
Mhm.
As a result of the medicine I wrote for him.
Yeah.
And so I started thinking of, okay, how do we, and the parallel path to this is I take duloxetine for my post concussive headaches, exact same drug, exact same dose. And it was the one thing that gave me headache relief after 2 years.
Hmm.
And so we're talking, and he's depressed and he's frustrated, and I'm writing this book, and I don't know what inspired me to tell him about it. He had no idea what the quadruple aim was, and I'm blathering on about this, and but he's a bright, articulate guy, and I'm like, are you interested?" And he's like, "Well, yeah, I guess so. What do you want me to write?" And I was like, "Just write." That's literally all I told him, and he did, and it was amazing. And then we had this meeting to talk about opportunity, and the book kind of then took on a life of its own, of the physician talking about the existing issues and the patient's perspective on the existing issues. But more importantly than that, our synergy created this inspiration, and hopefully empowering individuals to play their part,
Hmm.
to really get the 330 million of us out there to start to do something to um, create positive change. And I'd like to, if I can, um, give you an example of really just this past weekend. I was with a friend of mine, and we were talking about the book, and of course I never shut up about the book, and that's just the reality of things, I suppose. um, but he's been a friend forever, and he's like, "Todd, I don't know what I can do. I'm a chemist." And I said to him, I said, I'm with an entity called Medicine Forward that is really gaining some momentum, to amplify these voices. I said, "You can donate $5, donate $10. That's something you can do to help others."
Yeah. So tell me about what Medicine Forward is.
Sure. So Medicine Forward started as a grassroots physician organization founded in 2020 by Eric Topol, Emily Silverman, and one of my good friends, Gabe Charbonneau, amongst others, to really start to consolidate physician voices, work on healing and restoring the physician patient relationship, which is so important and so valuable, and often lost in our for profit system that we're in now.
Hmm.
Currently, at the tail end of 2023, we're really working on infrastructure and the foundation of Medicine Forward. And now, ironically, we have a meeting right after this to talk about some of the next things that we're doing, possibly moving towards a national summit. And there's some other things cooking in the background that I don't want to usurp some of my privileged knowledge, if you will.
Yeah.
Um, but ultimately, we want to be the voice for change, the
Hmm.
voice for positive change. And the connectivity and the networking that's occurring in some of these other um, institutions that we're connected with. For example, the Lorna Breen Foundation, Medicine Forward is a tier one collaborator to that. And it's been exciting to see what they're doing in terms of breaking down barriers for clinicians to get the help they need and the help they deserve, and take down some of that stigma.
So
So,
where do you see your greatest obstacles in this path?
oh boy,
Nothing
that
like
is
a
that's
small question.
oh wow. I think um, the system is designed currently from a fiscal perspective to profit a small percentage, really. And I think some of the existing infrastructure um, might be one of our biggest obstacles. Without naming names, I mean, we can all fill in those blanks, whether we're
Mhm.
talking about insurance or big pharma or existing lobbying, so on and so forth. Those are going to be some big hurdles. However, if you have not just thousands, but hundreds of thousands or maybe millions of people voting in a certain direction or voicing their opinions about certain things or taking down the prior authorizations that exist, that I think we all would agree as physicians that we detest greatly and don't add value to patient care. So I guess I'm dancing around the answer to this
Yeah.
a little bit, but I think we can all see what I'm talking about,
Yeah.
right?
But then let me ask you on the flip side, where are you optimistic? I mean, these are huge elephants in the room here. Where are your
The
ripples,
Oh,
right? I mean,
totally. Yeah, that's but the people are there, right? Like the vast majority of us that went into medicine went into it because we wanted to help others.
hmm
And many of us are realizing that just putting our head down and seeing patients isn't enough, because things have got to change. And those voices are starting to get louder and louder and louder. The podcasts, the books, all these things, all these people, they're out there.
Yeah.
And if we all consolidate, we're going to be a powerful force. And there's just many examples of things that have been done, like Tina Shaw's work in New Jersey regarding prior authorization reform.
I don't
You
know what
know,
that is, but sounds good.
yes, exactly, right. It can't be bad if we're reforming it, because what's going on now stinks. And you could just go down the list of others that are doing wonderful things out there. And so that's what gives me hope. That's what fills me up. And so, as I joke, I'm not going to shut up about this stuff until we start to see some of these needles move.
Yeah. So before we go, I wonder if you have any advice. I mean, I love seeing the path that you took, and you made the point of how each sort of decision that you made sort of led you to where you are. But I would like to hope that most of us don't have to go through what you went through, like with the wrecking ball of having a complete, you know, breakdown and storming out type of thing. What advice do you have to people? Like what to you to your prior self, what advice do you have that might have let you get to this place in a more gentle way? Because I think you're doing what you truly want to be doing, but maybe you didn't have to suffer so much along the way.
Yeah, wow, that's a beautiful question that I is so germane to where I'm at right now. I think there's two parts to that, if I had to answer it. I think the first one is um, recognizing and dealing with perhaps trauma from the past. Um, I read about it in the book a little bit, not in great detail, some trauma when I was a child in terms of enduring bullying and that kind of thing. And really up until recently, I don't really think I ever dealt with it. My
Hmm.
siblings weren't even aware of how bad it had gotten at one point. And so I would encourage people that if you have those kinds of skeletons in the closet or demons or whatever you want to call them, don't just push them aside. Address those, look at them head on, get the help you need, go to counseling. That's all okay. And then the other part of it, is a type A, maybe type A plus personality and perfectionist that many of us are. We can't forget self-care. We can't forget self-compassion. That is
Mhm.
so important. And I'm learning more and more. And and realizing that I done that at those times, maybe it never would have got to that boiling point. So
Yeah.
those are two things I would strongly encourage everybody to do.
Those are beautiful, beautiful points. And yes, we are all good at compassion for others, but not so much at the self-compassion piece for sure. Well, Todd, thank you so much for joining me today. This was truly a beautiful conversation. And I can say from the bottom of my heart that I hope you are successful in your mission.
Oh, thank you so much, Jen. This was truly a joy.
All right. And to send us off as usual, a great big thank you to our listeners for choosing to spend your precious time with us. I hope to see you again for the next episode of Reinventing the White Coat. That's all for this episode of Reinventing the White Coat. If you enjoyed this conversation, subscribe now so you don't miss an episode. If you're interested in coaching or in being a guest on the podcast, you can reach out to me online at shaercoaching.com. Thanks for listening, and don't be afraid to live your best life.